It's good to see you, Peter. Thank you so much for being with us. As we said, it's such a difficult time for our nation. We're trying to reopen. At the same time, we're worried about the health of all the folks across the country. What is that's front and center for you?
Hi, Nicole. Thanks for the time. So for us at Nuance, we're the leader in conversational AI for a number of vertical markets, healthcare being the largest one, and we have 90% of all hospitals and 60% of all physicians use our technology every day. So, the struggles that they're facing is they're in the business of taking care of people. And with COVID, not only has that been very traumatic in terms of just trying to do the right thing for people, but in terms of their organization, a couple of big things have happened that they have to deal with because the elective procedures have been cut down. Often, most of these healthcare organizations have lost upwards of 50 to 60% of their revenue. This is starting to come back. And why is that important for us? Because obviously, if they don't make money to support their physicians, they can't take care of us. And secondly, there's a pandemic in healthcare, what's called clinician burnout. They spend on average, if you can believe it, twice as much time doing administrative requirements as seeing patients. So you put these two things together, you have physicians and nurses that are totally burned out. You have healthcare institutions that are trying to recover from a significant drop in revenue, and they're trying to take care of us during this pandemic. So what's on our mind is how do we help our clients take care of people and also financially survive and prosper?
Yeah, and that's part of it. I saw reclaim revenue, streamline operations, alleviate some of the pressures of the industry. These are the types of things you would be doing regardless, right? I mean, in any time. But now it's sort of, in turbo boost because of the situation, right?
Absolutely. I mean, before COVID, these two trends, which is how do clinicians spend more time taking care of patients? I'm sure when you've gone to a physician, as most of us have, you feel rushed. The clinician's often distracted or dealing with the computer and not necessarily focusing on you. So that's a problem that was there before COVID. And secondly, most hospitals operate in a very thin operating margin, a couple of percent. So imagine if you're in a business where your revenue drops 50% and the people that drive the care and the create the revenue are also completely burned out by this pandemic because they are afraid of getting sick or making their family members sick. So we deliver technology into the workflow using AI that allows the clinician to refocus on the patient with speech recognition and this technology we call ambient clinical intelligence, where you just have a conversation with the patient and the software automatically does all the administrative functions of the physician and allows them to focus on you, the patient, and also helps them drive the right revenue recovery. And we've launched that product recently in partnership with Microsoft, and we're seeing great gains from the technology as, again, we can help them drive revenue recovery and also do a better job taking care of their patients.
Tell me about AI and how it enables organizations to prioritize and protect some of the seniors, actually using the sound of their voice. And that's this is something exciting for your company over the last month or so, right? That's been developing. And how will it help the bottom line?
Yeah, so one of the capabilities we have, instead of in the COVID, normally what happens is with our technology, our clinicians cut the amount of time that they spend on this administrative function so they can see more patients and about a 20% improvement. So you can actually take care of more patients or spend more time with patients. And that helps, again, on the patient side and the revenue side. Related to the COVID and seniors, one of the things that voice lets you do is you don't have to touch as many things in the room and risk getting COVID or transmitting. So they can control basically their entire environment by voice without having to use more PPE or risk getting the patient sick. So not only is it good for the patient, it's good for the clinician. And most importantly, from the hospital's point of view, in addition to doing their mission, which is taking care of people, it helps them collect the right amount of money for what they deliver. And in healthcare, you may not know this, but it's not just how many patients you see and how many surgeries you do, but you don't get paid in healthcare for what you do. You get paid for what you document you do. So our technology allows the clinicians to rapidly document what they're doing using their voice, which allows them, again, to spend more time with patients and drive significant more appropriate revenue for the institution. A large hospital might generate another $50, $100 million a year, plus save hundreds of hours of their clinician time by using our technology. So it's good for everybody, the patients, the physicians, and the organization as a whole.
It was interesting how you had minimal COVID-19 impact to the quarterly results. I know you revised guidance. Just a quick thought about going forward 2021. Are you, status quo? Are you wait and see? Or are you highly optimistic? Just a quick thought.
Right. So real quickly, as our CEO announced on the last earnings call, we took a little bit of a hit just because our clients were very consumed in the last quarter, but most of our revenue is recurring revenue. So it was a very small hit to our non-strategic business. And we feel that COVID's accelerated all the things that drive our business, which is reducing clinician burnout, improving revenue, and telehealth has exploded. We now support technology inside the telehealth encounter. So when you have a virtual visit, the documentation writes itself for the physician when they're done with the visit. So mid to long term, we feel very optimistic about the business. It may get a little choppy over the next few quarters, depending on what goes on, but mid to long term, we feel even more optimistic, surprisingly, in a way, given the pandemic, because it's put more pressure on the solutions that we offer that help solve very big problems for our
Peter
clients.
Durlach, Senior Vice President, Healthcare Strategy and New Business Development. Peter, thank you so much of Nuance Communications. Thanks for joining us here